There's one decision you actually need to make before December 7th this year. Do you switch your Medicare Part D plan or leave it exactly as it is? Most years, for most people, leaving it alone is the right call. This year, that might not be true, and if you get it wrong, it could cost you more than you think. Here's why. There's a program you've probably never heard of that's been quietly keeping your drug plan premium lower than it would otherwise be. That program just got shut off, which means the plan that made sense for you last year might not be the cheapest or even the best fit option this year. And if you've seen headlines saying Part D itself is ending, it isn't. Your coverage isn't going anywhere and nobody's taking away your drug benefit. But the math behind what you pay for it just changed, and figuring that out is the actual thing in front of you. That is what I will explaining to you in this video: what changed, who it actually affects, and what you need to do before December 7th, because that's your deadline to act. Without wasting any time, let's get into it. Starting with why this year isn't a normal year. On July 28, 2026, CMS, the federal agency that runs Medicare, ended something called the Part D Premium Stabilization Demonstration, a year earlier than planned. Think of it as a federal cushion. The government had been paying insurance companies directly to keep their premiums lower than they'd otherwise charge. In 2025, that cushion cut average premiums by about $26 a month. In 2026, it was already down to $16 because CMS was phasing it out. As of January 1st, 2027, it's gone completely. That matters for your decision specifically because it means insurers are now pricing plans based on what coverage actually costs them, with nothing artificial holding the number down. CMS's own preliminary data shows the national base premium, the benchmark figure CMS uses to set everyone's plan costs, rising from $38.99 to $41.33, and the average bid insurers submitted is up about 24% year over year. That's not your number. Your actual premium isn't published until September, but it tells you which direction every plan is moving in, including possibly the one you're already on. The plan that was your cheapest option in 2026 is not guaranteed to still be your cheapest option in 2027, and that gap is exactly why this year calls for actually checking instead of assuming. Quick reason why that cushion existed at all, because it explains why this isn't insurers just being greedy, and it's worth knowing before you judge the increase. A few years ago, the Inflation Reduction Act capped what anyone has to pay out of pocket for drugs in a year: $2,100 in 2026, $2,400 in 2027. Before that law, people on expensive medications like cancer drugs or biologics could owe tens of thousands of dollars annually, with no ceiling at all. To pay for that cap, insurers got stuck covering a much bigger share of costs in the highest spending phase, up from 15% to 60%, 4 times what they were covering before. That was a serious financial hit for companies that only sell standalone drug plans, with nothing else to absorb it. So CMS built the cushion to keep premiums from spiking all at once, and it worked. A GAO report found premiums for people who stayed in the same plan would have nearly doubled without it. Now, the current administration has decided the cushion isn't needed anymore, with CMS Administrator Dr. Mehmet Oz calling it an unnecessary subsidy to large insurers. Whether that's the right call politically is a separate debate, and reasonable people disagree on it. What matters for your decision is simpler. The buffer is gone, and the price you're about to see is the real, unsubsidized one. So how do you actually answer the question, switch or stay? It comes down to 4 things. You won't have hard numbers on all of them until September, but you should know exactly what you're looking for when they arrive. First, are you even on a standalone Part D plan, or is your drug coverage bundled into a Medicare Advantage plan? If it's Medicare Advantage, the same plan that also covers your hospital and doctor visits, you're largely shielded from all of this, because those plans are funded through a completely different mechanism. You can mostly set this video aside. If you're one of the roughly 25 million people on a standalone plan, keep going, because this decision is yours to make. Second, does your current plan even still exist next year? The standalone market has been shrinking on its own, separate from this specific change. The number of available plans nationally dropped from 464 in 2025 to 360 in 2026, a 22% drop in a single year, with insurers like Anthem and Cigna pulling back from entire regions because the economics have gotten harder for them too. If your plan is one of the ones disappearing, staying put was never actually an option. You'll get automatically defaulted into a replacement, and that default plan is chosen for you, not by you. It might not cover your medications well, or might carry a higher premium than you'd choose on your own. You want to be the one choosing it, not receiving it. Third, how much is your specific premium actually going up? This is the part with the widest range of estimates, so it's worth understanding both sides. CMS's preliminary data suggests roughly 75% of standalone enrollees will see some kind of increase. The Kaiser Family Foundation, an independent, well-respected health policy research group, found about 45% landing somewhere in the $11 to $20 a month range, with roughly 25% staying flat or even paying less, depending on the plan and where you live. The administration's own projection is that most increases land under $10 a month. Independent analysts lean toward that higher $11 to $20 range for the largest group of people. Both are working off the same preliminary bid data, just with different assumptions. And nobody, including you, will know your actual number until CMS publishes final, plan-by-plan pricing in mid to late September. Fourth, and this is the one people skip, and it's honestly the one that matters most. What does your plan actually cost for your specific medications, not just the premium listed on the label? A plan with a lower monthly premium can easily cost you more over a full year if it has worse copays on the drugs you actually take every month. Picture two hypothetical plans. One charges $35 a month but has a high copay on a medication you take daily, and the other charges $45 a month but covers that same medication for almost nothing. Over a year, the cheaper plan can end up costing you hundreds more. The premium is one line item in a much bigger total, and it's the one number everyone fixates on because it's the easiest one to see on a postcard. Now, here's what you can take completely off your worry list because none of it is actually part of this decision. The $2,100 out-of-pocket cap in 2026, rising to $2,400 in 2027, that's written into law, and this change doesn't touch it. The $35 monthly insulin cap stays exactly as it is. Medicare's negotiated drug prices are still rolling out on schedule. 15 more drugs get their lower prices on January 1st, 2027, including Ozempic and Wegovy, with reported price cuts of 70% or more. None of that is at risk here. And if your income is limited, roughly $22,590 or less for a single person, or $30,660 for a couple, plus modest asset limits, the extra help program that covers your premiums and copays hasn't been touched at all. And a SHIP counselor can check your eligibility for free. Part D itself isn't ending, and the coverage itself isn't what's on the table. The only real question in front of you is the premium, and whether your plan is still the right fit. Nothing more, nothing less. So here's how you actually make the call, step by step. Right now, do nothing and don't panic. You don't have the real numbers yet, so any decision today is a guess dressed up as a decision. In September, watch for two things. Your current plan is required to mail you an annual notice of change. Read the whole thing because it tells you exactly what's changing for your specific plan in 2027, including the new premium. Around the same time, CMS publishes full plan data, and Medicare.gov's Plan Finder tool updates with real 2027 options for your area. Then, between October 15th and December 7th, open enrollment, you actually decide. Go to Plan Finder, enter your exact medications and the pharmacy you use, and look at the total estimated annual cost for each available plan, not just the premium line. That total includes the premium, the deductible, and what each specific drug you take actually costs under that plan. Everything you need for the comparison in one place. If your current plan's total cost still holds up against the alternatives, staying put is genuinely fine. You don't need to switch just because a program ended in Washington. But if a better fit plan shows up, or your current plan is one of the ones leaving the market, that's your signal to move, not a reason to panic. If any part of this feels like too much to sort through alone, SHIP counselors in every state will do it with you, free of charge. No sales pitch, just help comparing your actual options. Call 1-800-MEDICARE, that's 1-800-633-4227, or find someone local at shiphelp.org. So here's your actual answer. This isn't a Part D is ending story, and it isn't a panic and switch immediately story either. It's a check before you assume story. The premium cushion is gone, so the plan that made sense last year might not be the best one this year. But you won't know for certain until September, and the only real mistake here is deciding before then. or not deciding at all once the information exists. Read the notice when it comes. Check the plan finder in October. Compare the total, not just the premium. That's the whole decision, and now you know exactly how to make it. If this helped you figure out what you're actually supposed to do this fall, let me know in the comments and send it to anyone else on Medicare who's seen those scary headlines and wasn't sure what was real. And if you found this video helpful, consider subscribing for more videos like this. Take care, and I'll see you in the next one.